The best way of getting medication into the lungs for treating asthma is with inhalers, but the technique of using the inhaler is more complicated than what it seems. Everybody's seen other people with asthma shake up an inhaler, put it in their mouth, and suck on it, but that's not the best way to do it. The medication is propelled out of the canister at about 80 to 100 miles an hour, so the closer the canister is to the back of the throat, the more the medication is going to slam into the back of the throat and get swallowed where it's not going to do you any good. The important thing to remember is that we only use a portion of our lungs with each breath, and the medication gets to only those parts of the lungs that get air when you inhale. By emptying your lungs as much as possible and then inhaling as much as possible, you can deliver more medication to more of the lungs. The proper way to use a metered dose inhaler is to first shake it up very well. Exhale as much as possible, emptying all of the air out of your lungs. Next, put your inhaler an inch or two from the wide open mouth to increase the distance between the canister and the back of the throat. This provides a little more time for the plume of medication to slow down so it can make the bend and go down into the lungs. You then begin to inhale, and just as you start to move air into the lungs, that's when you squirt. Continue to fill up your lungs all the way, slowly, to pull all of the medication as deeply into the lungs as possible. Then hold your breath for about 10 seconds to let the medication settle out in the lungs rather than just blowing it back out into the room. If you need to take more than one inhalation or need to use more than one inhaler, take a few normal breaths to clear the propellant out of your lungs and repeat this procedure for the next puff. Some people advocate the use of spacers, which have two minor advantages. First, they provide a little more time for the propellant to evaporate off of the particles of medication, resulting in smaller particles that can penetrate more deeply into the lungs. This was more important with the older CFC propellants, but it's not as much of an issue with the HFA propellants that are now in use. Second, the larger particles of medication that can't make it down into the lungs will fall out in the spacer rather than in the mouth. This is also a minor concern, particularly if you rinse your mouth or brush your teeth after using the inhaler. Since I always recommend that my patients use their steroid inhalers right before brushing their teeth, this is generally not an issue. However, some people who are sensitive to medications continue to get some irritation in the mouth from the steroid inhalers and do better with the use of a spacer. If you want to use a spacer, the technique is pretty much the same, except that you don't use the open mouth technique with a spacer. Forcibly exhale all your air, then put the mouthpiece into your mouth and seal your lips around it so that all the air you inhale comes through the spacer. Squirt the inhaler just after you begin to inhale, completely fill up your lungs slowly, and hold your breath for 10 seconds. To ensure that your spacer continues to function properly, be sure to follow the manufacturer's instructions for cleaning the spacer that came in the box with it. Most inhalers now come with built-in dose counters, so you know exactly how much medication you have left. Be sure to pay attention to the number of doses remaining in your inhaler and order your refills in a timely manner so you never run out.